Hi, and welcome to our presentation today titled It Starts With Them, Ensuring Youth-Centered Care and Family Inclusion. We are happy to bring this session today to you through the Association of Maternal and Child Health Programs, also known as AMCHIP, in partnership with the State Adolescent Health Resource Center, also known as SARC. I'm Eliana Sarmlis-White. I'm the Senior MCH Specialist for Adolescent Health and Youth Engagement at AMCHIP, and we are welcome to have you today to have a discussion around youth-centered care and what it means in the context of family involvement. So today we're going to run through a couple of items that are going to touch on these objectives that you see here. First, we're going to look at a different range of definitions, both that have been established and also some original items from our adolescent health workforce on what exactly youth-centered care is. So that way you can see what are some common terms, approaches, or paradigms that we use to kind of define the service delivery for young people. In addition, we'll also explore, sometimes what happens with common pitfalls in trying to deliver services to adolescents and also young adults, whether it's healthcare delivery and also programming. And then we'll wrap up discussing the importance of the parents, the caregivers, the family involvement in ensuring youth-centered care is delivered at high quality. So those will be our objectives today. And I want to mention that the content is going to touch on a few of the maternal and child health competencies. So the maternal and child health competencies are a set of skills and knowledge that help to build the capacity of the workforce in maternal, child, and adolescent health. And so these are a few of the competencies that we'll be discussing or are related to what we'll be discussing today, including knowledge base around youth-centered care, cultural competency in terms of modifying the systems to meet the needs of young people, definitely around interdisciplinary and interprofessional team building to ensure comprehensive care to adolescents and young adults, and then also working with communities and systems. You can find out more information about these competencies and other skill sets on MCH Navigator, which is a central portal for learning opportunities related to the maternal and child health field. And this is based in the National Center for Education in Maternal and Child Health at Georgetown University. And before we get any further, I want to acknowledge the investments in adolescent and young adult health, and in particular around state public health, in partnership or in some cases supported by HRSA, the Health Resources Services Administration, and in particular, the Maternal and Child Health Bureau. So today's presentation is being brought to you by AMCHIP, again, the Association of Maternal and Child Health Programs, and we represent the 59 state and jurisdictional Title V MCH block grant programs. In addition, our partners at the State Adolescent Health Resource Center are the center that represents the workforce, particularly around the adolescent health coordinators that help deliver programs to the state public health departments. Also, AMCHIP and SARC are part of a larger technical assistance resource center known as the Adolescent and Young Adult Health National Resource Center, also supported by the Maternal and Child Health Bureau, and that is based at the University of California, San Francisco. And also, we want to acknowledge the National Network of State Adolescent Health Coordinators. All right, so let's dive right in. We asked a handful of adolescent health professionals, what do they think of when they hear the term youth-centered care? What exactly comes to mind and how they would define it? And then we also were able to find a few of the established definitions from national and also international organizations. So we'll take a look at what they said, the adolescent health workforce, and also what the national organizations and international health organizations define it as well. So one definition is that youth-centered care is an approach to providing high-quality health care that meets the needs of young people. It includes thinking about policies and procedures, physical environment, forms, gender inclusivity, accessibility, and equity. And it's also about fostering an approach in which young people have a say in these things, have a way to change things, and are listened to. So again, that's one definition from an adolescent health professional. The SARC, the State Adolescent Health Resource Center, indicates that youth-centered care is a framework that weaves together the standards for healthcare with the qualities that young people are entitled to and demand, including youth-friendly services, settings, and experiences. And through this, healthcare providers and systems are guided to do the, quote, right thing, evidence-based care, the, quote, right way, care designed for young people. Again, so here you see two very comprehensive definitions about what youth-centered care looks like. So take a minute to just explore both versions. All right, and we'll move on to the next one. So another definition by adolescent health professional is that youth-centered care is focused on receiving and valuing input from a young person and targeting the influencing factors within the community that affect their well-being. Now, according to the World Health Organization, youth-centered care is also known as adolescent-friendly health services, and it's an approach which brings together the qualities that young people demand with the standards that have to be achieved in the best public services, organized by 5 objectives: accessible, acceptable, appropriate, effective, and equitable. So I want to make note that the World Health Organization definition is not easy to find, actually, but nonetheless, you see that it describes both an approach, but then also, you know, a set of expectations defined by these 5 objectives. And we want you to make note of these 5 objectives because this will actually help define some other standards of care that we'll talk about a little bit later in the presentation. And our final set of definitions are more to the point or shortened versions of youth-centered care, which include, you know, healthcare that is targeted for or at youth and takes into account their needs. It's built with input from youth. Another definition that was offered includes care that centers the needs and experiences of youth and takes into consideration their specific concerns and developmental stage. And finally, another definition is it means that youth are involved and have a voice in their care. Now, according to the American Academy of Pediatrics, or the AAP, patient and family-centered care is based on the understanding that the family is the child's primary source of strength and support. And further, this approach to care recognizes that the perspectives and information provided by families, children, and young adults are essential components of high-quality clinical decision-making, and that the patients and family are integral partners with the healthcare team. So one thing I want you to notice is that for the AAP's definition, even though it might be labeled as youth-centered care on their web resources, it actually doesn't say youth-centered directly in their definition. In fact, they center around patient and family-centered care. So again, one thing to consider when you look at AAP's definition for how they define youth-centered care, it really starts with a patient, but it's very much looking at the family influence as well. So again, that's a range of definitions. So in what way, you know, there's a few ways in which you can see that there are some similar terms that are used. Also thinking about input from the young person or input from the family. In some cases, there might be something that might look a little different. We want you to make note of what definition is your agency and your clinical partners operating under. How do they define youth-centered care? And not just define, but how do they also implement those components of the definition? So we have a lot of different ranges of definitions for youth-centered care, but how does that translate into practice? A few years ago, the Adolescent and Young Adult Health Resource Center actually took the World Health Organization's definition, and they built upon those 5 objectives of youth-centered care into the 8 standards of quality youth-centered care that the WHO endorses. And you can see a little bit about this infographic. On this infographic, you can see a few of those elements further defined. It includes health literacy, community support, appropriate package of clinical services, provider competencies, equity and non-discrimination, facility characteristics, data and quality improvement, and also adolescents' participation. What's interesting to note is that under the World Health Organization, the standards of quality youth-centered care actually had adolescents' participation listed last. And so we decided for our infographic, we would actually put that at the top, because as you can see from not just definitions, the importance of the input of young people is really essential to informing youth-centered care. So we wanted to make sure that we elevated that component to the very top. A few years later, the State Allison Health Resource Center built upon these 8 standards of care, added a few more standards. And then you can now see that these youth-centered care resources include 11 components. A lot of the same similar ones that you see from the infographic on the left-hand side of your screen. So again, thinking about the importance of health literacy, guideline-driven care, accessibility, data, welcoming environments, and understanding of youth development. You can also see confidentiality is something that's highlighted in the SARC's version of youth-centered care resources. So again, these are just elements that build upon those definitions and help really define the holistic approach to delivering care and services to adolescents and also young adults. So you've heard the definitions, you've seen some of the components of standards of care. So what happens when this translates into practice? Well, sometimes we don't always hit the mark. You have these expectations, you have great intentions, but sometimes we have to realize that what you expect may be a little bit different from reality. And that's okay. It's a learning process. It's an opportunity to look at what indeed could be improved. What are we doing well? But then also what's not hitting the mark. And so we asked several adolescent health professionals around where is the room for improvement? And here are a few responses to that question. One includes the development and outreach of clinical services, policy development, and health education could be improved. Another is that work needs to be done to better incorporate youth voice in decision-making related to how programs are delivered. Youth need to be listened to when they tell us what doesn't work and what approaches they think make more sense. And then also, programs do not receive or value input from youth often. And there is only one provider that focuses on putting youth and their needs at the center of their care. And this needs to expand. So again, you see a range of needing more youth input and also building the capacity of the providers to put the needs of the youth first in their service delivery. So we're going to take a break from this presentation actually and talk a little bit about some laundry. No, I'm just kidding. We're going to transition into discussing parent and caregiver involvement and family inclusion and what that means in the context of youth-centered care. So we're going to be discussing Velcro and dryer sheets. So Velcro, for many of you that know, it's a type of set of materials that helps stick together. It's made up of different fibers. There's 2 sides to Velcro. And in order for it to work, you have to have those 2 sides literally stuck together, or else it does not hold pieces. It can't hold anything in place. And then you have dryer sheets. So for those of you that use dryer sheets, what's its function? Many of you may think about, well, it reduces static when I put my laundry in the dryer. Others may also say that it freshens your laundry. Also, dryer sheets reduce cling. So again, thinking about Velcro and dryer sheets, and you're probably wondering, well, what's the connection? Well, actually, it's about thinking in terms of, how often or how involved a parent is in their adolescent's healthcare experiences. From a young adolescent, in which you need to be a little bit more like Velcro and help them understand and navigate the healthcare system. So that this may mean helping to make their appointments for their preventive services, for any other annual visits that need to be done, to taking them to their doctor's office, to also possibly answering questions around family history or other developmental needs. And then you transition from being Velcro, being very much on top of it, stuck together, to dryer sheets, where you help reduce that cling. And what that means is, as a young person is developmentally growing, becoming more autonomous, parents and caregivers are still very much influential and need to be engaged, but the engagement looks a little bit different. For example, you might help teach a young person, your child, how to make appointments, how to keep those doctor's appointments, how to ask questions when offered by the provider, what to expect from a healthcare visit, and also how to make sure that you follow up when needed. So again, it's a matter of you're transitioning from Velcro and being very much stuck and being very much together to dryer sheets, where you help when needed, but then when the job is done, you don't need to be there 100% of the time. I mean, you're not going to wear your laundry, your clothes with the dryer sheets still stuck to it, right? So again, it's around having that balance, helping a young person grow and develop in a healthy and normal way, but then also, trying to ensure that there is still that connectedness. So again, it very much can seem like a balance. Where are you trying to be more of a parent, or are you trying to be more of a supportive figure in their life? But nonetheless, it's important to involve families, as appropriate. And when families are genuinely involved, there's a lot of benefits to it. With healthcare professionals, it actually improves care coordination and health outcomes at the individual, youth, and family level. It can help increase participation in positive health behaviors and decrease health risk behaviors that lead to adverse outcomes. Providers and public health practitioners have more direct access to understanding the experience and needs of the young person, because parents and caregivers are seen as experts of their children. It can increase influence and role modeling, and it can better position the young person for success and the next set of developmental milestones. So for example, when a parent is involved in scheduling the annual well visit for an adolescent, for example, even if the parent does not accompany their child to the visit, if they help schedule the appointment, they are more likely to make sure that that visit is taken care of. So again, these are just some examples of how engagement can be very much influential in ensuring that the young person gets the healthcare services that they need. Also, I want to mention that in terms of family engagement, sometimes, it's around that balance. It goes back to that balance. An indicator of a high quality adolescent well visit includes time alone with the provider. So sometimes as a parent, you may be asked to step out of the room so that the provider has a chance to engage in a discussion with the patient. And this is not in any way, shape, or form to acknowledge that there's something secretive going on, or that there is some sort of question that's going to be asked that they don't want you to know about. This is a quality indicator for routine healthcare service delivery for adolescent health. So again, it's just a matter of meeting that indicator and allowing the young person to engage in a dialogue with their healthcare provider. So it's an opportunity to build that set of skills to discuss any healthcare needs and also acknowledge anything that they might be going through, and also to ensure their privacy and their confidentiality. So again, these are some things to consider. There's a balance in family involvement, but nonetheless very influential and very important for healthy development and role modeling. So a few years ago, the Adolescent and Young Adult Health National Resource Center actually developed some tools to help parents understand well visits and also other interactions with the healthcare system for their young adolescent or also young adult. And so as you can see here are a few resources to help kind of demystify some things that maybe parents need to understand regarding healthcare delivery systems for youth, including what is a well visit, how is a well visit different from a sports physical or any other sort of clinical visit, and then also why it's important to ensure that preventive services are accessed annually and also when needed. And the good thing about these tools is that you can actually download them and insert your contact information for your agency or your organization. And also the Resource Center will be modifying these to include some other questions that may come up in the time after COVID in which youth will be accessing the healthcare system or returning to normal in some way, shape, or form. So again, these are just a few tools that are available for families to understand the importance of adolescent preventive services, and also help answer some questions that you as a parent or caregiver may have in regards to healthcare for your young adolescent or your young adult. So we've thrown around a lot of terms and words, and it's important to understand that there are certain terms that resonate with adolescents and young adults, as well as parents and caregivers. When we asked a few of the adolescent health professionals and also parents, what type of terms really resonated with them, some mentioned that youth-centered parent-engaged care was one set of terms that really spoke to them. Others preferred youth-friendly or parent-involved care. There's also a few individuals that mentioned that they like the term youth-guided family-driven care or youth and family-engaged care. But it's important to note whatever set of terms you or your agency use to define adolescent health, it's important to ensure that the standards of youth-centered care are not just mentioned, but they're also embedded in practice. So what's next? So it's important to think about, what are you doing well right now in terms of delivering or offering youth-centered care standards, and where is there opportunity for improvement? Consider the input you currently have from youth and young people in your programming, in your healthcare delivery, and also think about, in what ways parents are currently involved or what ways parents want to be involved. Again, this is just food for thought, but just some things to start off with. The good news is there's plenty of resources that you can explore. Some of these resources we highlighted earlier in the presentation, and some are available to you for other needs that you want to improve in terms of youth-centered care, or how to increase parental involvement in the healthcare delivery system of adolescents and young adults in your community. So again, this includes some full compilation of resources from the State Adolescent Health Resource Center, some infographics that we shared earlier today, again, that parent FAQ fact sheet regarding adolescent well visits, also some other parent tools, and of course, more definition around the standards of youth-centered care that we shared earlier as defined by the World Health Organization. So we encourage you to take a look at these and also see how you can apply it to your current programming or your healthcare delivery systems for young people. And we'd like to thank you today for joining us. Again, there's more information on our websites, and we also have several contacts here that you can reach out to both at AMCHIP and also the State Adolescent Health Resource Center.